Welcome back, everyone, to Couchside Cancer Chats. From the exam room to the couch, real talk about pet cancer. I'm Dr. Irina Gramer, a veterinary oncologist, and maybe you've seen or heard me in our previous podcast episodes. Today's episode is one of the most important conversations I find we can have in oncology, and it's really a day-to-day thing. And it's also one of the most difficult ones, I find. So today we're talking about palliative care, what that means, and end-of-life support for our pets living with cancer or chronic diseases, and how we can best support the family that's involved in that process and guide them through this. Important to know for me is always that palliative care is not about giving up, it's about shifting the focus from cure to comfort, from length of life to quality of life. It's one of the most important aspects that I talk about every day. And these conversations matter just as much for veterinarians as they do for pet owners. It's good for the vets out there to have an understanding of that as well, how to lead and guide those conversations. So to help us guide through this today, I'm joined by Dr. Laura McGuffog, who is a veterinarian herself with a strong focus in exactly those aspects around palliative care, end-of-life support, supporting our families through this. Laura works with Rest Your Paws, a dedicated veterinary service that provides all of this care, and she'll tell us a lot more details around this today. So I'm so thankful that Laura can join us in this today. So welcome, Laura. And I think we'll probably start off with some guiding us into this chat conversations and get Laura's take on these things. So I want to dig a little deeper into this palliative care aspects. And when family hear the words palliative care, it's often associated with end-of-life care. And I think our conversation today, I want to make sure we're able to tell the difference between the two. So what do these families or some of the pet owners misunderstand maybe, and how can we get earlier into the conversation around this, Laura?
Hi, hello. Thank you for having me. And yeah, thank you for asking an important question, because I do think the words palliative care tends to often give owners a sense of second best or of giving up. And I think sometimes even in the veterinary profession, we can still kind of see it as being such. As not pursuing gold standard. And it really stops owners from doing all that they can, having that kind of misconception. Palliative care is comfort care at the heart of it. It doesn't have to be, necessarily carried out when end of life is approaching. Palliative care can be carried out alongside what we consider more like curative treatment. It's I guess often mistaken for hospice care, which is when we are looking at that last sort of 6 months of life. So I guess what I'd want people to know is that palliative care really, as you said, it shouldn't be about giving up. It really should be about making the most of the time we've got. That comfort care is comfort for the pet. It's comfort for the family as well. It's really focusing on all of the things that come alongside age and chronic illness, things like anxiety for the pet, even for the family, nausea, loss of appetite, issues with mobility. There's so much that we can do to provide comfort for the pet and to help the family feel like they're doing everything they possibly can, regardless of the diagnosis.
Yeah, I agree, Laura, because I think if it isn't with palliative care, then almost all the other treatments that we're doing, if that's chemos or immunotherapy, they're that much harder to do. Because I think if we don't have the comfort care around it, then the focus just shifts to this maybe aggressive chemo treatment, but there's so much more to consider. And I think a lot of the time the patient doesn't just come with the cancer, it's probably the
Yeah.
biggest topic. There might be comorbidities, other problems.
Mm.
We definitely don't want to be forgetting about those, especially when we've got our older geriatric guys that are very arthritic. So I think, yeah, that it's very important to tie together. It shouldn't be one or the other, or it could be palliative care on its own, I suppose. I
Well,
think,
and it's often
yeah,
those, I was going to say, it's often those comorbidities that are causing, more detriment to that pet than, often than the cancer itself. It's often their poor mobility and as you said, arthritis that I think if we could
mm,
ask the pet what is causing them the most discomfort from a day-to-day basis, they would
yeah,
probably complain about those chronic aches and pains over, the most recent cancer diagnosis. So
yeah,
I think
definitely.
it's about sort of approaching the animal as a whole.
Yeah, exactly right. I see it a lot. I think, and some of that I've really changed and shifted over the years, coming out of the residency program, where you a bit in the mindset of I do as I've been told, so to speak, where a lot of them have been given steroids, high doses, especially for lymphomas, and then you see these, especially large breed dogs, that really struggle with their mobility if the steroids make those muscles go away.
Yeah.
And I'm much more careful considering that now, and even choose should this patient even receive steroids, for example.
Yeah.
I think it's very important to consider them as a whole.
I
Absolutely.
think, we can't explain to the pet why we're going ahead with chemo, why we're going ahead with these
Yeah.
treatments. They don't understand what our end goal is. We trust that they trust us to know that we're just trying to help. But because we can't explain those things, I think we have a massive duty of care to make sure that, especially when we are carrying out this treatment, we're really prioritizing their quality of life and we're making them as comfortable as we possibly can throughout treatment. And if we decide to not go ahead with treatment, we don't leave that family feeling guilty, like they haven't sort of
Yeah.
done the best or done the most that they possibly could do with their pet. It's not all or nothing. And I think in these circumstances, the only wrong thing to do is nothing. It's
Yeah.
uh, yeah, making that family feel like they haven't cared or loved their pet enough to go ahead with everything, or feeling like they've failed when chemo and when treatment doesn't go the way that they'd hoped it was going to go, and they
Yeah.
can at least pull back on knowing that they've kept that pet as comfortable as possible, and you know put even more focus into their quality of life and helping them through those aches and pains that come along with age, then they probably would have if they hadn't had that cancer diagnosis, and maybe even seeing that silver lining that they have helped that pet potentially age more gracefully because they've become more aware of those comorbidities.
No, absolutely. Couldn't agree more, which I think brings me to the second question in a way that ties in beautifully with this discussing quality of life for our patients, because that is at the end of the day the goal, whatever the pathway to it looks like. So I think it gets talked about a lot, this quality of life, and but in real life,
Mm.
I mean, how do you actually help families understand that a bit better? How do you explain what is quality of life to them?
Yeah, I think, I'll be honest, I do think I have an easier time of it, and my team has an easier time of it because of where we get to hold these conversations. Being able to be
Mhm.
in that family's home, it certainly helps them to drop their guard and drop their walls and have a more honest conversation. It also allows us to see the pet at their best and see them carrying out their
Yeah.
normal routine, which is great. But at the heart of it, I think it's inviting the family to kind of share that pet's story. What does that pet's routine look like? Who are they as an individual? What do they love to do? Are they a lazy Labrador? Are they a hyperactive Kelpie? What is it that, gets them out of bed in the morning, or, keeps them on the couch all day if that's their predisposition? But what is it that they love to love, they love to hate, because quality of life is individual. And we can
Yeah.
certainly break it down into things like, the physical, the emotional, the social, and that does help to kind of break things up for families to get their head around things. But ultimately, you are and you should be having an individual conversation around that pet and their place in the family unit, um, and what it is that they enjoy. That can
Mm.
be hard to sort of do in one session or in the consult room.
Yeah.
That's why I do think it's so important that people are given, scoring tools, like quality of life scoring tools, and checklists that they can go through, because
Hmm.
everyone's different as well, just like the pets, and different,
Yeah.
scoring tools will help them to get their head around quality of life, and allow them to assess it with other members of the family as well,
Mm.
because they have different opinions. But
Yeah.
ultimately, for me, quality of life is yeah, what makes that pet's life worth living, what provides them
Yeah.
happiness, and yeah,
Yeah.
it is unique for every pet.
Yeah, I often, struggle is probably the wrong word, but I do sort of have a conversation around that and try and find out from the owner what makes their dog tick and happy. And a
Yeah.
lot of it is their toy playing, but what they almost always say is, my dog's still eating fine. And
Yep.
I find that comes up a lot. And
Yep.
I think on one of your talks before, that I was listening to, it is obviously our pets have to eat in order to
Yep.
maintain and sustain themselves. And I suppose whilst you might have your Labrador whose sole cushion food may be, they'll probably eat to the very last minute, I think. I don't know, how do you handle that, I suppose, when they talk around that?
I mean, and you're right. That sort of gets brought up all the time, and particularly when we are considering end of life, it's often used as like a lifeline as to why maybe it's not.
Mm.
And I guess trying to rephrase it or reposition that in the family's mind of, that's fantastic. We never want this pet to get to the point where they've lost the
Yeah,
will to eat, because
yeah,
that's not just, an enjoyment, that is a necessity of life. And I guess, repositioning and saying, I also love my food, but there's a lot more to my
yeah,
personality, and there's a lot more to my
and
day than,
eating.
than just my appetite. As much as I wish that could be everything, it's not. So getting them to sort of open up a little bit more about the things that their pet loves doing. Is it going to the park? Is it going for their walk? Is it greeting them at the door and sort of having a bit of zoomies? Is it snuggling up to them in the bed at night?
Yeah,
What else is it about their routine that they they think of being normal for their pet, or being the quirk of their pet's personality. um, and I guess sometimes when people are sort of bringing up those objections or those concerns around quality of life, and sort of they might be clinging to things like, he's still eating. I guess
mm,
asking, kind of flipping the conversation and asking, is there anything else, aside from still having that drive to eat, is there any other behaviors in the home that's maybe questioning whether or not, it is time to consider
yeah,
goodbye, or that's making you question whether, there is still good quality of life? So get them to open up a little bit more about what they're seeing as still being normal for their pet, because maybe
mm,
they're right. Maybe that pet does still have a bit of spark, and they do just need some
yeah,
more comfort and palliative care. But try to avoid kind of shutting people down when they kind of raise those concerns, or they raise those queries of, oh, but he's still eating, he still greets me at the door. and
yeah,
and look at the emotion under that, because under that is someone telling you, I'm worried that I'm making decisions too soon. And so that's what
yes,
they're scared about, and that's the conversation we need to have, not just, you know well, we can't just rely on an appetite for good quality of
yeah, it's a
life.
good point. Yeah, that's an excellent point, I think, Laura, to sort of guided back to that core question of their potential worry that this isn't the time yet, it's too soon. Because that's probably one of the next questions I get from owners is, so when is it actually time? You know, how am I as pet owner going to say, this is the time now, and how do we best guide and inform them without overwhelming or frightening
Yeah.
them, that this is potentially time?
I mean, I think a big part of that, and I know we're under immense time pressure, but a big part of that is actually taking the time, if you can, to get to know that pet a little bit more, to
Mm-hmm.
understand who they are and you know what's important to the pet, what's important to the family, because that's going to create a lot more trust. That's also going to make you feel a lot more comfortable in guiding that family, because at the end of the
Yeah.
day we're a part of this decision as well, and that can sometimes be scary for us as vets to be
Mm.
responsible for when is it time and for potentially ending a life. So I think we owe it to ourselves to kind of understand a bit more about the situation so that we can feel comfortable in that decision. I do think it's not a moment, it's a window. We have with our pets, we have a window of opportunity where we can provide a good death. And so
Mm.
what I tend to talk to people about is that, my priority isn't just quality of life, it is quality of death. And
Mm.
I'm in a privileged position to have helped a lot of families farewell their pets. And I've seen a lot of
Mm.
beautiful passings. I've seen some passings that maybe haven't gone the way that the families wanted, my own pet
Yeah.
included, because I've missed that window. And so all I can do is try to help the families identify when euthanasia is a reasonable option, when we're in that window where we may not be able to really guarantee good quality of life, but we are in the window where we could guarantee good quality of death. And that's
Yeah.
just as important when we're looking back on that pet's life. We want to remember a farewell that complements that beautiful life that pet's had, right?
Yeah.
So I guess when I talk about when it's time, it's, understanding that pet's quality of life, understanding what's important to that family, asking the questions that prompt the family to have those thoughts. What is it that I want for my pet? What kind of farewell do I want for my pet? How am I going to personalize it for my family? You know, how is my pet feeling? Are they still able to go about their day the way that I think they want to and the way that they enjoy? Um, and I guess really, really tapping into the the indecision, the guilt, the grief that comes with this kind of decision, and companioning that family through it. Own how scary a decision it is. Own the fact
Mm.
that no one ever feels 100% comfortable saying goodbye.
Doing that.
I've
Yeah.
never had a family that wasn't terrified that they were saying goodbye too soon. And it is that fear that often means that people miss that window and feel like they
Yeah.
miss that window and live with regret that they've maybe seen their pet suffer or seen their worst day. And I think all we can do as vets is use that past experience, whether it's our own with our own pets or with the families that we companion, and just try to build up their courage of saying goodbye in that window where a good death is possible.
Yeah, I find whenever I have sort of these conversations and the owners have had a previous dog or a cat that they had to do this with, I think most commonly people's fears and worries that I find is they're left it too late. And there's
Yeah.
maybe a little bit of regret around that.
Mm.
And some are actually very open about that's not a mistake. They're wanting to repeat, and they're sometimes
Yeah.
open or starting the conversation on their own. I find that more and more.
Mm.
I think that's what I find in the conversation happens a bit.
And I think on that, I often, what I tend to say to people that are struggling with that regret as well of
Mm.
maybe feeling like they waited too long for a previous pet, because I know we get sort of, queried and asked about that as vets quite a lot. My response is typically that, look, hindsight is a wonderful thing, but at the end of the day, we never feel 100% okay about this decision. It's never going to feel okay to say goodbye to something and someone that we love so much. If we were to have said goodbye a day earlier, you may have sat there wondering if you could have had more time. We
Yeah.
never have a perfect moment where you feel okay
No.
about this. All we can do is be brave and trust that we know our pets, and hopefully, we get to be vets that make this decision and this experience a
Yeah.
little bit easier for people.
Yeah, absolutely. And removing any guilt and that around that decision making, I think. I
Just
think,
grounding people.
yeah, very good point. Yeah, I find when I speak to families, they almost have this sometimes, or not every time, feeling like clinging on to those little moments of spark or the good
Mm.
days they might still have. And I suppose what I was interested to hear is how do you gently guide them into understanding that and bringing it into the context of the big picture of how the pet's doing.
Yeah, and I've listened to a few different sort of palliative and hospice care vets phrase this, because
Mm,
we get asked this quite a lot. I
yeah.
One sort of once said that, look, when she herself is on her deathbed and her family comes to visit her, she knows that she'll put on a big smile, and she'll give them all a
Yeah.
hug, because
Mm,
that's what you do for the people that you love. And I think our pets do the same thing. I'll go to
mm,
families home, and we always bring a nice treat for our pets when we help a family say goodbye. And they'll often say, oh, he hasn't eaten for days, and yet he'll, perk up and hoover down a
yeah.
cheeseburger or a packet of chicken nuggets. And
Yeah.
I hope that they're gaining strength for the next life or the next journey. But I think
Mm,
ultimately, a lot of the time they're doing it because they know our facial expressions. They know it's making us happy to see them have that final meal. And I think that's a lasting gift that they give to their family. But I think they do that with a lot of things. They know what makes us happy, and I think our pets do their best to make us happy. I
mm,
I I don't want pets to get to a point where there's not even a spark of joy in their day. We don't have to wait until they really are at the point of suffering to have permission to say goodbye. That is what
yeah.
euthanasia is for, is to prevent that worst day. And
Yeah.
it's so easy to cling to those moments. Like, it is so easy, and I've done it before with my own pets, but you have to look at the day as a whole. And
Yeah.
sometimes that means getting perspective of friends. Sometimes that means keeping a calendar so you can hold yourself accountable to
Mm,
those days, not just those moments. And just understanding that this is such a hard decision, and maybe you do need
yeah.
someone else to come and help you see beyond those moments, and actually see the day as a whole.
Yeah, absolutely. I think sometimes it can be very helpful, another family member or friend to
Mm,
join in on that conversation that can be so
yeah.
powerful to help with that. Laura, why do you think these conversations around euthanasia and end of life care they happen so late? Why do you think that is?
Uh, I mean, there's a lot of reasons. I mentioned before about time pressure, and I do think the
Mm,
time pressure that we're under as vets makes it very hard to build the kind of rapport with clients
mm,
that makes us feel safe enough to have this kind of conversation, particularly,
mm,
if it's clients that we don't know well. I think
mm,
in general, we are a very grief avoidant society. We're
mm,
not taught how to talk and approach grief. We're not very good at it, with our family members and our friends, let alone strangers. And I think it is quite a big skill set to become comfortable talking about
mm.
grief and having hard conversations with
Yeah,
people, and doing it compassionately, not just, you know, going through a checklist, and not
yeah,
just kind of slipping into that clinical mask, which I think we can also often do when we're feeling uncomfortable. I think I think a lot of it comes down to fear and
yeah,
uncertainty of whether
yes,
to offend a family, upset them, unnecessarily, break the trust or the relationship that we have built with them. But the reality is, and what I always remind veterinary teams is, if you're finding it this difficult to bring up this conversation and have this conversation with a family, imagine how hard that family is finding it to bring it up with you. Because to be
Yeah,
the
yeah,
first person to approach the conversation about saying goodbye to your best friend, that's
hmm,
awful. And I
yeah,
do think it is a massive duty of care that we have to take on as a veterinary, profession, to be initiating these conversations, gently and compassionately, because
yeah.
that family should never feel like they're giving up. They should never feel like you know, their their love for their pet is going to be questioned by approaching that conversation first.
Yeah, I often, I don't know, rightly or wrongly, you might have some more insight into that. I can sort of maybe gauge it or see it in their faces when they're sitting in front
Mm,
of me, that is in the back
yeah.
of their mind. And then I often lead with saying, I'm really sorry to sort of bring this up now. We've pretty much just met, right? This is my first
Yeah.
consult with you. I'm just going to go there and say that this is a terminal disease. Your dog or a cat is experiencing all of those symptoms already and is uncomfortable. That it's okay if they deep down actually would just like to end this for their pet. So it's how I'll try and start the conversation.
Yeah.
They either jump on that and it becomes a discussion. Sometimes it falls onto dead silence, which is a bit of a awkward moment sometimes. And then I'll
Mm,
try and start again the conversation saying this is also okay if this is not the time for this and we don't want to be having
yeah.
this conversation right now. But then, they've at least heard it from a vet that has just assessed their pet, it's okay, even
Yeah.
if we have just met. So I suppose I'm in the unique position in a way that I get cases referred. So they've
Yeah.
already had their diagnosis or their first assessment, and they're seeking professional or a specialist opinion on it. And I think if I
Mm.
say that, and hopefully that makes it okay for them to talk about it.
Well, I think you're
Yeah.
just creating a safe space. From the get-go, you're
Mm,
telling them, okay, I'm comfortable. I'm opening up the space for us to have this conversation one way or another.
mm,
You're and just acknowledging, especially, the severity of what the pet's going through.
mm.
Um, that's what they'll be clinging to. If that family
Yes.
does, when that family says goodbye, they will be clinging to our words as professionals that it was best for the pet and that they said goodbye to prevent suffering, and that was the under our advice and our
Yeah.
recommendation. And as I said, I do think we have that duty of care to take some of that burden off of the family's shoulders to really advocate for the pet. It can be one way to start this conversation as well is just by acknowledging what the pet's going through, that, whatever
Mm.
the disease process is severe and it is terminal, as you said. Another way to approach it is by saying, look, this is a lot for you. This is, I know you guys have just had this diagnosis, it's come out of nowhere, or you've been, on a massive journey for the last 6 months. I've been through your notes. You've done absolutely everything
Yeah.
that you could. And I can only imagine how exhausted you all must be. I can imagine how exhausted your pet must be in and out of hospital. Whatever the situation, acknowledging and complimenting the family as well for the work that they've put in, both whether it's emotionally, time, financially, acknowledging where that family's at and what they've been through, and then sort of seeing how they respond to that before you then maybe start the permission piece that it might be okay for them to stop. Because
Yeah, absolutely.
for so many families who go down the specialist pathway or even just in and out with their GP, who just kind of get swept up in not knowing when they're allowed to say no more, when they're allowed to say, you know what, no one's having fun anymore. I'm not having fun anymore. I can't appreciate the time I have with my pet any longer. My, my pet is not their self. They feel miserable at home. I haven't seen them at their best in weeks, but they
Yeah.
keep going because they often feel like, I guess, they just get trapped on this journey. And I do think we have a duty of care. We owe it to them and the pet to sort of say, look, at any point, if you want to stop, I'm here to support that, because you know him better than anyone, and you know when maybe this isn't working anymore.
Yeah, absolutely. That's so powerful, definitely. Um, I've thought of one other thing I was going to ask you today. It's sort of, I mean, there'd be probably majority vets listening anyway, but it is specifically for vets. Our first
Yeah.
opinion vets mainly that are having to have probably a lot more of those conversations.
Mm.
Maybe they have a little bit of the advantage sometimes to have known that family and that particular pet for quite some time, probably a lot longer than when I meet them in comparison. It's just sort of to see for those vets who find these conversations hard, understandably,
Yeah.
what's sort of one shift that can make an end of life discussion feel less overwhelming, I suppose, for them.
I think going into this area of veterinary medicine, and something that I didn't fully appreciate and realize until I started having, much more open and I guess intense conversation with families. I didn't realize how much of an effect my words as a vet and as a veterinary professional, and even just as another human being, would have upon a family, you know, and in how they feel about saying goodbye to their pet and their pet's end of life experience. We have so much power to
Mm.
potentially alleviate guilt and help a family move through their grief in a
Yeah,
much more healthy way. We, and the words that we say, that can be what a family clings to for years to come about whether or not they did the right thing. And the
yeah.
number one thing that families want from us is reassurance. It's not just all the facts. It's not just the diagnosis, the prognosis, that kind
Yeah,
of thing. They want to know what we would do, what we would do as pet owners. I know that can feel daunting to answer, but essentially they just want to know that they're not struggling alone, and that they're a good person and they're making good decisions for their pet. So I think when having these conversations, don't just hear the words that the person's saying to you. Think about what it is that they're asking, what it is that they want to know. How can you provide reassurance? Because I guarantee you, every single family feels like they're saying goodbye too soon, or feels like they don't have
yeah,
permission to make this kind of decision for their pet. And they really need us to lean forward as fellow pet owners, as professionals, as human beings, to provide some comfort and reassurance that they are doing the right thing and that they do have permission to provide their pet with a good
yeah,
death, and permission to think about, you know, providing a beautiful ending to a beautiful life, not just extending life, but actually finding a way to say goodbye in a way that's personal and special to them and to their pet. And as I said before, being able to find that window of opportunity to provide that. I think
yeah,
that
absolutely.
becoming more comfortable in guiding someone with that, and having those kind of conversations, it's incredibly special, and it provides comfort for families for years to come, to a degree that I don't think we fully appreciate as a profession. And as I said, I've been
Mm.
privileged enough to talk to a lot of
Yeah,
people, talk to their previous experiences about euthanasia, and it does. Our words resonate with people, and rather than
yeah,
being scared about that, I think sees it as an opportunity to do good and to
yeah.
become
And
more
be proud
comfortable.
of that. Yeah, be proud
Yeah,
of.
it's how powerful, how special that we can have that impact on people.
No, absolutely. I couldn't agree more, Laura. And I think that was so, so helpful to talk about all of this today. I very much hope that our vets out there, maybe the nurses that are listening in and the pet owners, have a better understanding of what palliative care is. It's not that one thing or immediate end of life care. It's seeing the patient as a whole, really, making all those decisions. And I think another maybe very powerful thing is they're not alone. May that be other family members or friends. I think there is the vet nurses I find, especially the ones I work with, they often get a very different take on the family or have a very different way into the conversation. It can be such a powerful tool as well, almost making the conversation, removing it from the facts to a more personable one. So I think it's just important that this whole idea around palliative care, end of life care, is not dropping some bomb on people and leaving them. It's really the guidance and support around that.
And it takes a village, you know, as you said, it's the vet, it's the nurses, it's the reception team. And, you know, it is a lot. And people do want support outside of the vet clinic. And that's why we have pet loss counselors. That's why we have services, you know, like what I do, like Rest Your Paws, that come into the home and provide additional support. This is heavy work, and no one should have to do it by themselves. No family should have to go through it by themselves. And that's why there is support out there. It's just knowing how to direct people to that support so that they can get, you know, what it is that they need and deserve.
Absolutely. Have access to that in all of this so they feel supported. Absolutely. I think, Laura, that's a great note to finish on. I think it was incredibly insightful to have you. And I very much hope that we can do this again one day. I think the listeners would benefit from this. So yeah, thank you so much for today, Laura.
Oh, thank you for having me. You know, I'm happy to chat with you anytime.
Thank you so much.